My name is Allie, and today I'm discussing the persons diagnosed with diabetes with an A1C value greater than 9% from the Healthy People 2020 census. Quick review on diabetes. Diabetes is where one's blood glucose level is too high, meaning 126 milligrams per deciliters or higher. Type 1 is where one's body does not produce insulin at all, and this is due to the immune system attacking insulin-producing cells. Type 2, which is the most common type, is where the body does not use insulin well or produce enough. There's also a thing called gestational diabetes, and this occurs during pregnancy and will go away after birth, but is known to be a precursor for type 2 diabetes, so something to be aware of. What is an A1C test? Well, it's a blood test over a 3-month period that provides an average level of blood glucose. Hemoglobin carries oxygen in our red blood cells, and in return, glucose attaches itself to the hemoglobin. Therefore, our red blood cells spread the hemoglobin throughout our body. Red blood cells have a lifespan of 3 months. Therefore, the A1C tests the change in a cell's life cycle, seeing if glucose has increased and decreased. Normal A1C levels are 5.7% or lower. Pre-diabetic levels tend to be 5.7 to 6.4%, whereas diabetic levels are 6.5% and higher. And mind you, the higher it is, the more glucose is in your blood. The A1C is super important and can help one prevent diabetes, especially type 2. However, the A1C can be faulty. It is known with people with sickle cell anemia that they will have inaccurate tests or test results. These levels will either show too high or too low and will not be the correct glucose level in one's body. This chart shows the number of glucose levels with a different A1C test score. This gives you an idea of how much milligrams of glucose are in each percentage of A1C test scores. Note that 9% is at 215 milligrams per deciliter, when I mentioned earlier that 126 is the beginning of diabetes. So that's quite a difference. Okay, current issue in the U.S. Due to the Healthy People 2020, there has been little to no change with people with serious A1C test scores. Our target is 16.2% by 2020, and in 2012, we were at 21%. That increased from 18% earlier, which was in 2008. This is a serious problem, folks. There are 30 to 45% of people who die annually of diabetes, and 10 to 15% die of complications from diabetes. Why is this happening? Well, too much sugar is being consumed in the American diet. One Harvard study stated that implementing a way to get diabetics to eat healthier would help lower A1C levels. By treating the patient and not the numbers, we should be able to see diabetics maintain a healthier lifestyle and diet. So what's the overall goal? Well, the goal is to help reduce A1C levels in patients by using a lifestyle change for the diabetic to decrease sugar intake. This will help conceive a healthier lifestyle for diabetics and decrease major ailments that come with diabetes. If we can implement these changes, we should see a lower in A1C levels throughout the nation. Thank you for listening today.